Hi everyone, we are going to tackle a very interesting chapter today. This is chapter 21. It's on the lymphatic and immune system. Now, before we get into the actual content of the chapter, I want to do a quick overview or review with you. Throughout the course of our previous few chapters, chapters 19 and 20, we've talked about the fact that the circulatory system consists of the use of arteries and veins when we look at our blood vessels. And we've talked about the fact that arteries are always shown as red and the veins are always shown as blue, with the exception, of course, of the pulmonary arteries and the pulmonary veins. But either way, the arteries are the ones that will carry blood away from the heart and distribute it throughout the rest of the body, and then the veins will be the ones that bring the blood back to the heart. Now, what if I tell you that when we see our fluid distribution, if the arteries are able to distribute blood throughout the body, the veins can only return about 80% of that fluid back to the heart. So what happens to the other 20% that the veins can't handle? Well, that's where this chapter will come into place, because it turns out that in addition to having your arteries and your veins when it comes to the circulatory system, we have another set of vessels that will help us move fluids around. And those are going to be your lymphatic vessels and your lymphatic system. So over here we have an illustration, and notice how you do not see any more blue or red, but instead you see green, and that's because these vessels will be part of your lymphatic system. Your lymphatic system will basically take the 20% of fluid that was left behind by the veins, and it will take up the fluid and return it over to the heart. And as it's returning it to the heart, it will also go ahead and will filter the fluid to see if there's any abnormalities or any pathogens present. And if it notices that you have some bacteria or viral component, it'll be these lymphatic vessels that will actually be able to alert your white blood cells and other specialized cells to come over and try to protect the body as best as can be. So this is one of the reasons why chapter 21 will cover both the lymphatic system and the immune system as one, because they're very codependent of each other. Alrighty, so let's take a look at this illustration right here that's on our right-hand side. And what you're seeing is the ever familiar red for the arteries, blue for the veins. You can see the capillary bed in the middle. And then now you have the intertwining of the green vessels as well, and those are going to be your lymphatic capillaries. And as I was just introducing to you in our previous few slides, you want to think about your lymphatic system as the one that's going to be able to pick up the fluids that are left behind by the veins, and these fluids usually tend to sit in between the tissues, and the lymphatic vessels will pick up these fluids, and the main goal is, as it's transporting the fluid back to the heart so it can be combined with the overall circulatory system, we're going to see that it's going to help us protect our body from any type of infection and or diseases, because we're going to be able to filter this fluid and we're going to be able to activate our white blood cells if need be. So over here on slide 1, it says when you take a look at your lymphatic and immune system, it's going to be essential for maintaining your fluid balance, because it's going to be able to pick up that 20% or so that's being left behind by the veins and return it to the heart. And second, it's going to be able to protect our body from infection and disease, because as I've mentioned before, it'll be filtering the fluid and alerting your white blood cells if need be. Within the functions of the lymphatic system, we're obviously going to see the fact that it is going to play a role in our immunity, and part of that is because it works together with your different T cells, your B cells, your macrophages, and all other white blood cells. And this will be one of the main mechanisms that the white blood cells know that you have a foreign antigen in the body that needs to be taken care of. Remember that when we discussed our white blood cells, one of the unique features about them, besides the fact that they maintain their nuclei and that they can be divided as granulocytes and agranulocytes, one thing that your white blood cells do is they like to stay in the tissues. They do not like to go into the blood vessels normally and circulate around. It is only when the lymphatic system will alert these white blood cells that there is a pathogen, that these white blood cells will hop into the blood vessels and will go over to the site of injury. But we'll talk more about that as we proceed through the chapter. The second function is lipid absorption. We see that there are specialized lymphatic capillaries called lacteals that are in our small intestines that are going to help us increase our observation of specific lipids that we consume in our diet. Most of the time, the fluid that's absorbed in your lymphatic system will be clear, but when it comes to the lacteals, they'll have more of a yellowish color, and that is because of the lipids that they are transporting. And the third option is something that I've already mentioned previously. The fact that your veins only pick up about 80% of the fluid, that means that the other 20%, which is going to be important for fluid recovery, is going to be the responsibility of the lymphatic system. And as it's picking up the fluid, its main goal is not only to filter it, but also to return it ultimately back into the bloodstream. All right, now here are a few terms that you're going to see throughout the PowerPoint. First off, the fluid that enters your lymphatic system, we're going to call that lymph. Okay, the vessels that transport the lymph are going to be called your lymphatic vessels. And then you're also going to see the mention of lymphatic tissue and lymphatic organs. Now, a tissue, as you know, is just a collection of different cells. And what we're going to talk about is that there are certain parts in the body where you'll have these groups of white blood cells that will kind of aggregate together. These will then be different lymphatic tissues. If we see that the white blood cells, so like your lymphocytes and your macrophages, concentrate together in one area, but they are surrounded by a connective tissue capsule, then instead of just saying it's a lymphatic tissue, we're going to say it's a lymphatic organ. So like for instance, when we talk about your lymph nodes or when we talk about your spleen, these are all going to be lymphatic organs because they're separated from the rest of the body and they have that connective tissue capsule surrounding them. Here is a quick little illustration of one of your lymph vessels. Go ahead and take a look on your right-hand side. And what you should notice is that the lymph is basically entering through the vessels, through the little openings that are on the side. It is a one open-ended, I should say, vessels, meaning that once the lymph is in it, it cannot escape. It has these little valve-like flaps that will allow the lymph fluid to suck into the lumen of the lymph capillaries. Most of the time, the lymph capillaries are slightly more permeable than your veins, making it easier for them to recover the fluid that's left behind. And as you can see on your slide, I did highlight for you that you will find lymphatic capillaries in the majority of places in the body, with the exception of the central nervous system, CNS, bones, cartilage, and bone marrow. Now, on this illustration, it's trying to show you the fact that as lymph will flow through the capillaries, what we're ultimately going to do is we're going to start accumulating or aggregating them into larger structures within your lymphatic system. So for instance, go ahead and take a look at the illustration, and what you're going to notice is as you're looking down, for instance, by the legs or by the arms, you have lots of lymphatic vessels and lymphatic capillaries that are being labeled. Also notice how some of them have like these kidney-sized shaped structures on the lymphatic vessels. Those are going to be your lymph nodes, and your lymph nodes are going to be very important because that is going to be our location where we're actually filtering our lymph and we're activating our immune cells if need be. As the lymph will travel through the lymphatic vessels, through the lymph nodes, what we're going to eventually see is that as it gets closer and closer to the heart, the vessels are going to start clumping together into larger structures, and you're going to see the mention of lymphatic trunks, and eventually you're going to see the mention of a right lymphatic duct and a thoracic duct. So go ahead and find that on your illustration. It is obviously highlighted in the red boxes, very close to the heart. And what we see here is that by the time that the lymph gets all the way close to the subclavian veins, we see that it can either be housed in the right lymphatic duct, which means it's coming from the right side of the head, the arm, and the chest. If the lymph is coming from anywhere else, so below the diaphragm, the left side of the head, the left side of the arm, the left side of the chest, it's going to be funneled into the thoracic duct. And then collectively from both ducts, the lymph will go ahead and flow into the left subclavian veins. Once it's in the left subclavian veins, it will make its way over to the vena cava, where it will then be dumped into the right atrium. And from that point, the lymph will mix back in with our circulatory system, and we do our blood flow just as we would normally expect it. So what we've discussed in our chapter 19 notes. So here's another look at how your lymphatic vessels are coordinating their lymph flow with the blood that is in your arteries and your veins. So notice how on the right-hand side of the illustration in red, you have your cardiovascular system showing you the fact that it is doing its blood flow through the body, it is dropping off the oxygen and the nutrients to the tissue. And if you then migrate over to the left side of the image, you see all your blue vessels indicating your veins. Notice how the black arrow is indicating that we're returning back to the heart. But keep in mind that when it's returning back to the heart, it's only returning with about 80% of the fluid. The other 20% is going to be traveling into green vessels. Those are going to be our lymphatic vessels. And if you take a look all the way at the bottom of the illustration, you're going to notice that it starts off by labeling the vessels as lymphatic capillaries. Those are going to be the tiny ones. And as they then start clumping together, they're going to be labeled as lymphatic collecting vessels. The vessels will allow the lymph to flow through the lymph nodes. Look at those little kidney-like structures, kidney bean-like structures. And that will then lead them into a lymphatic trunk. And from there on, it will go into the lymphatic duct. And the duct is what we were just discussing on our previous slide, that you can have your right duct or you could go ahead and have your abdominal duct. Of course, where does it go after that? What's the blood vessel? Hopefully we all went with our subclavian vein. Here is another look at the flow of lymphatic fluid and obviously within the vessels. And I'm sorry if it's kind of like a little bit of redundancy. I just want to really make sure that you guys understand that the lymph is the fluid that is left behind, and the main goal is that as it's traveling through the lymphatic capillaries, it makes its way over to the lymph nodes where it can be filtered, and then eventually it will go into a trunk and then into the duct system, returning the fluid into the subclavian veins so that we can cycle it back into the circulatory system. The other thing that we should definitely talk about is what exactly is going to make the lymph flow within the capillaries and the trunks and the ducts. And it turns out from an embryonic standpoint, your lymphatic vessels are very similar to your veins. So they're going to be relying on a lot of the same mechanisms that veins utilize to return the blood to the heart. So for instance, they can go ahead and have rhythmic contractions within the lymphatic vessels itself that will kind of milk the lymph and allow it to be collected and move upwards closer and closer to the heart. We also see that they're embedded within our skeletal muscle. So as our arms and our legs contract and relax, they actually will assist with the flow of the lymph in the lymphatic vessels. As the lymph gets closer to our thoracic region, we see that every time that we inhale and exhale, we have a thoracic pump that basically assists with moving the fluid closer and closer to the cardiovascular system over to the heart. And obviously by the time it gets close to the subclavian vein, we do see that the bloodstream there is a little bit faster than the rest of the body. So we'll see that it will draw in the lymph easier, allowing it to converge and combine together eventually in the vena cava and into the right atrium. And I don't think it should come as any surprise that exercise is really good, because what exercise does is it helps increase the pumping of the heart. And as the heart pumps faster, the blood will also move faster within your blood vessels, which means that your lymph will also go ahead and be filtered and returned at a faster rate. Now, as we see the collection of the lymph and we see that it's being filtered, we're obviously going to also have some immune cells that might be alerted, especially if there's like a pathogen, like a bacteria or a virus that's noticed within the fluids. So I would like to start introducing you to some of the lymphatic cells that you're going to see within the chapter. And hopefully, as you're looking at the list right now, some of them look very familiar for you. So for instance, your T cells and your B cells. We discussed those in chapter 19 when we talked about the agranulocytes and how some of them are lymphocytes. The T cells get their name because they're going to mature in the thymus. B cells get their name because they're going to mature in the bone marrow. And we also have a third cell that came out of the lymphocytes. Those are going to be your natural killer cells. They are going to be playing a very important role in what we call immunosurveillance. And they are fantastic at attacking and destroying things like bacteria, viruses, also like transplanted cells. And I'm just giving you a really quick overview of them because as we move along, we're definitely going to handle them in more and more detail. But you're going to see the natural killer cells, your T cells and your B cells consistently pop up. And then we're also going to talk a little bit about what we call antigen presenting cells. Antigen presenting cells, or APCs, are cells that are able to detect a foreign antigen. They're able to take a piece of that foreign antigen and present it to either the T cells or the B cells. So they're kind of like an executive assistant where they notice the change and they're able to take a piece of that pathogen and bring it over to the immune cells, the T cells and the B cells, that can actively fight off that pathogen. Within the category of antigen presenting cells, we have our macrophages, we have our dendritic cells, and we have our reticular cells. And I've kind of jotted down some notes on the slide, so I reminded you that your macrophages come from your monocytes. Your dendritic cells you find in body surfaces. So like for instance, if you guys remember when we did the integumentary system in 2085, we talked about the fact that you have dendritic cells that kind of sit within the keratinocytes looking for any foreign invaders. And then your reticular cells, they are fantastic at making a connective tissue framework around different lymphatic organs and nodules, and the framework will almost serve as like a scaffolding hold where we can hold on to different white blood cells if we need them. Here is a very nice illustration of a macrophage doing what it does best, and that is detecting any type of foreign invader. And it's going to use what we call pseudopods, which are extensions of its cytoplasm to kind of reach within the tissue and the extracellular material until it comes into contact with the foreign entity, which in this case is going to be the yellow rods, the bacteria. And when it finds them, the macrophages will go ahead and do phagocytosis, bulk eating. It will engulf the foreign entity, and once it's done bulk eating it, it will go ahead and present part of that bacteria to the T cells and the B cells. And that's what makes a macrophage an antigen presenting cell. And as we are kind of chit-chatting about the cells, don't worry, you're going to see them pop up many different times throughout the chapter. And every time they pop up, we'll talk about a little bit more detail as we keep going on. So these few slides are basically just like a nice little introduction to the world of your lymphatic system, your immune system, some of the most common cells, as well as this slide right here, which talks about the fact that within the text, you're going to be introduced to what we call a diffuse lymphatic tissue and lymphatic nodules. Diffuse lymphatic tissue tends to be more of just a collection of random cells that you tend to see within your mucous membrane, sometimes within the connective tissue of a lot of organs. They tend to be more patches of cells, very informal, very abstract in their overall shape. A nodule or a lymphatic follicle will be a little bit higher level of organization. We tend to see that these have a higher amount of cells that are coagulated or dense together. I think a really good example that most of us should be familiar with by now are the Peyer's patches. The Peyer's patches are these nodules that sit within the small intestines, and they are just filled with different white blood cells that we can obviously utilize as part of our immune system. Our highest level of organization will be our lymphatic organs. Now remember, for something to be an organ, that means it will have a connective tissue layer that will surround the outside or the capsule. And what we see here on our slides are some of the lymphatic organs we'll be discussing, including our lymph nodes, our tonsils, our thymus, and our spleen. Now, the lymph nodes, we see them in 6 different areas of the body, including the cervical, which means in the neck region, axillary by the armpits, inguinal, which is by the groin area. Those are relatively close to the surface. And then in the thoracic, abdominal, and pelvic area, they're a little bit deeper inside of the cavities. But that is where you will have clusters of the lymph nodes, which were the kidney-shaped beans that we were looking at in the pictures previously. Your lymph nodes are obviously very important because that is where we're going to be filtering our lymph fluids. Your tonsils will be guarding the entrance to your oral cavity and part of your nasal cavity. So we'll discuss how many different types you have and how each of them functions. Your thymus should be a little bit of a reminder. We talked about it in the endocrine chapter. Your thymus is going to be really important because it's going to help us activate our T cells, and your spleen will play a role in the hoarding, or I should say, the safeguarding of some of the red blood cells and white blood cells. And we'll talk about that as well as we move on along the chapter. All right, now here on this slide, it talks about the fact that within the lymphatic system, we see that the organs can either be divided as a primary or a secondary organ. And this is actually a very important slide because what you're going to notice is that the primary lymphatic organs are only 2 of them. You have your bone marrow and you have your thymus. And a primary lymphatic organ is going to be an organ that's going to be able to make cells immunocompetent. Immunocompetent means that the cell is able to distinguish between a self-antigen and a foreign antigen, aka an invader. So what we see happening here is when we look at cells like our T cells and our B cells, both of these cells are examples of your lymphocytes, which is a form of a white blood cell. We see that the T cell has to go over to the thymus to become immunocompetent, and the B cell has to go over to the bone marrow to become immunocompetent. And because these 2 cells have to go to those particular locations, that is then what makes the bone marrow and the thymus your primary lymphatic organs. Because once again, they teach the T cells and the B cells to become immunocompetent, discriminate between self and foreign antigen. Your secondary lymphatic organs are going to be everything else, okay? So these are going to be like your lymph nodes, your tonsils, your spleens. We're going to see that they're still very important to our lymphatic system. We're going to see that we're going to take all our different white blood cells, including our T cells and B cells, and we're just going to kind of store them in the secondary lymphatic organs. And we're going to wait for the cells to be recruited over in case there is a site of infection or a pathogen that needs to be fought off. So notice on your notes how it says secondary lymphatic organs are going to be populated with immunocompetent lymphocytes only after the cells have matured in the primary lymphatic organs. So you will only get access to the T cells and the B cells in the secondary lymphatic organs after they have learned to become immunocompetent. And that will only happen in your primary lymphatic organ, which is your thymus, T-cell, and your bone marrow, B-cell. Alright, so here are our lymph nodes. So I have said this many different times already. Your lymph nodes are going to be very important because they will be the only location in your lymphatic system where you actually filter the lymph. So the fluid that is moving its way to the lymph vessels is going to get filtered in the lymph nodes. And when it filters it and it cleanses it, that basically means that this is then when it's able to detect if there's a foreign antigen inside of the fluid. And that would then be an excellent way for your T cells and your B cells to become activated and to be brought over to the site of injury. And we wouldn't know if you had any type of pathogen unless you filtered the fluid, and the only location to filter it is in your lymph nodes. So your lymph nodes, only organ that will filter the lymph, and it's also the most numerous lymphatic organ that we have within the system. Your tonsils are another one we should take a look at. So your tonsils are going to basically guard your pharynx, which is the back of the throat region. When you look at your tonsils, and please go ahead and take a look at the illustration that's on the right-hand side, we're going to see lots of different epithelium tissues, and we're also going to see these little openings, these little creps. Inside of the creps, you're going to have nothing but white blood cells that are just sitting there, waiting for a pathogen to come across, and they will start attempting to destroy it. Now, it makes sense that we have tonsils in the pharynx, because that is going to be the back of the throat that's exposed to both the oral and the nasal cavity. So lots of abilities for items to come into the body through those orifices. So we see that when it comes to our tonsils, we have three different sets. We have our palatine tonsils, which is what you find towards the back of the oral cavity. This is the one that many of us are familiar with. This is the one that's most commonly infected. If you get a tonsillectomy, most of the time this is the one that you remove. It's a pair of them. They sit on either sides all the way in the back of the oral cavity. If you bear with me for just a few seconds, I'll show you this on an illustration. You also have your lingual tonsils. This is another pair of tonsils. These sit all the way in the back of the tongue. And then you have a solo one. This one's going to be called your adenoid or your pharyngeal tonsil. This one dangles on the wall of the pharynx. So you have your palatine on the side, all the way by the back of the oral cavity, two of them. You have two lingual tonsils all the way in the back of the tongue, and then you have one pharyngeal tonsil that sits towards the wall of the pharynx, so towards the back of the throat. Here is what it looks like in an illustration. So go ahead and take a look. Let's start on the left-hand side. You can see the labeling of the pharyngeal tonsil all the way towards the back of the pharynx. You can see your palatine tonsils, and then you can see your lingual tonsils all the way at the base of the tongue. And if you take a look at the illustration that is on our right-hand side, we see the mouth open wide. A lot of people actually confuse the ovula with their tonsils. They think that little part that dangles is their tonsils. It's not. It's the ovula. It helps with sound resignation. It's actually an extension of your soft palate. Your tonsils are those two patches that are on either side, and those just happen to be your palatine tonsils. Your thymus is the next organ to take a look at. Remember that your thymus is an example of a primary lymphatic organ, because this is where we're going to have our T cells become immunocompetent. I also want to remind you that in the endocrine chapter, we talked about the fact that your thymus will go through involution, meaning that it will start shrinking, so that by the time you compare a newborn to an adult, there is a drastic change in its overall size. Now, part of what makes your thymus a primary lymphatic organ is because it's able to make those T cells immunocompetent. And we see it can do that because if we take a look at it from a histology point, we see that within the thymus, it's divided in little sections called lobules. Each lobule will have a cortex and a medulla. The cortex, which is the outer segment, will be filled with different lymphocytes and macrophages. And your medulla, which as you can see in the illustration is the lighter color middle section, that's where you're going to have your mature T cells. And part of why the T cells can become mature and immunocompetent is because within the medulla you will have reticular cells that will help you form a blood-thymus barrier. And the blood-thymus barrier is going to protect the immature T cells as they're being actively trained to become immunocompetent so that there's no cross signaling between any type of pathogens that might come across in the body, because that would alter your chances of developing an autoimmune disease. So we're going to talk about how your T cells become immunocompetent in much more detail. But for now, just remind yourself that the thymus is a primary lymphatic organ because it makes the T cells immunocompetent, and this immunocompetency training will occur within the medulla because the medulla is separated from the rest of the organ by the thymus blood barrier, courtesy of the reticular epithelium cells. For our spleen, we're going to talk about the fact that it is going to be a fantastic harboring point or reservoir point for both our red blood cells and white blood cells. In fact, do me a favor and go ahead and take a look at the illustration that's on the right-hand side towards the top. That is your histology slide of the spleen, and you're going to notice that within that picture, they have indicated for you what they call red pulp and white pulp. The red pulp gets its name because it's nothing but a reservoir of erythrocytes, red blood cells. The white pulp is going to be a collection of white blood cells. So they're fantastic at creating these reservoirs of both red blood cells and white blood cells. Your spleen is the largest lymphatic organ. And we see that it has many different functions, including the fact that it's able to produce it's able to produce blood cells in our fetal stage. In adulthood, it doesn't do a role in blood production unless you come across a patient who is severely anemic, and then the spleen might kind of regress back to its original function. We also have discussed the spleen and the fact that it's considered the erythrocyte graveyard because, as you might recall from a previous chapter, red blood cells, when they get to be about 120 days, they lose that actin and spectrin and they lose that flexibility. So when they enter the very small capillaries in the spleen, they basically pop open and they die. So that's why your spleen is often called the erythrocyte graveyard. We also now know that it's going to be part of our immune system because it's going to allow us to filter the blood to see if there's any foreign antigen. Notice how it's filtering the blood. It's not filtering the lymph because that's only done in your lymph nodes. Now here we have an illustration of a clinical application, and basically what we see happening is if there's anything that's going to impede the flow of the lymph through the lymphatic system, you can get different applications that come into place. For instance, you can have lymphadenitis. Itis means inflammation, where the lymph nodes are responding to a foreign pathogen and they'll start becoming very hard. For instance, if you are not feeling well and you've ever you went to like a physical or whatnot, the doctor might go ahead and take their hand and kind of press lightly on your throat region or underneath your armpit. And that's because we now know that that's where a collection of your lymph nodes are, in the cervical region and in the axillary region. And if the physician notices that the nodules are hard, the lymph nodes are hard, that usually indicates that there might be some inflammation or that you might actively be fighting off a pathogen. You can also have lymphoma. Lymphoma is when you have cancer cells within the lymph nodes. Most of the time with lymphoma, it's due to the fact that the cancer has metastasized or spread from its original site, and it's now spreading across the body. In these cases, the lymphoma, if they go in and they do surgery, they'll not only have to remove the original tumor or cancer cells, but they also might have to remove some of your lymph nodes to prevent the spread of, obviously, the carcinogenic quality. The illustration is for elephantitis. This is based on a mosquito-borne roundworm infection, and what ends up happening is that the roundworms will actually clog up your lymph nodes, and as a result, the fluid can't drain. And this seems to be happening primarily in areas such as the legs, the scrotum for men, and the breast of women. So that's nothing but just lymph fluid that can't drain back and be introduced into the cardiovascular system. Alrighty, so we have, I feel, gotten a nice little introduction about the lymphatic system. We talked about the fact that lymph is the fluid that's left behind by the veins. It's taken up by the lymphatic capillaries, and then as it's being circulated through the body and on its way over to the subclavian vein, we know that it will encounter lymph nodes, where the lymph will be filtered to see if there's any abnormalities. Now, if a pathogen or an abnormality is detected, how exactly are you going to start defending yourself against it? And yes, we have different white blood cells, but what will be our exact mechanism of action? Well, it turns out that you basically have different ways of fighting off your pathogens. And on this slide right here, we take a look at the fact that some of your defenses are going to be classified as what we call non-specific, and others will be classified as specific. A non-specific defense is a defense that all of us have. We're all born with it. It doesn't require any prior exposure. We're all going to respond to it and utilize it the same way. So these are going to be things like your skin, that it's an external barrier, your mucous membranes with the production of the goblet cells that will hold on to any type of pathogen that comes near the orifices of our body, things like having a fever, having inflammation, having our general white blood cells. These are all examples of non-specific defenses. So your body will respond the same way every single time. It doesn't need to have a prior exposure, and from one human to the next, the defense will look identical. The second way that you can defend against pathogen is what we like to call in a specific mechanism, and this is really where you get your immunity from. A specific defense means that the body is responding based on the specific pathogen that it's exposed to. So the body will recognize it as a pathogen, it will figure out how to fight that pathogen, and it will remember that pathogen for the next time it comes across it. And when you have a specific defense, you're always going to have to utilize your T cells and your B cells. Why? Well, because your T cells and your B cells are the cells that are able to become immunocompetent. Remember your thymus and your bone marrow? So your T cells and your B cells can be specifically trained to recognize a foreign antigen, and they will mount a specific defense for that individual pathogen, and your immune system will recognize and it will remember this defense, and this will then become part of your immune system and how you build up immunity against certain pathogens. This is all based on being exposed to the pathogen, so it's a very specific method, and it will differ from one individual to the next because we're all exposed to different entities, we have different life experiences, etc., etc. So let's go ahead and let's just take a look at some non-specific defenses. So these are the ones that all of us have, and they'll always tend to react the same, right? So a good example would be any type of barriers that our body has to prevent a pathogen from entering. So obviously like your skin, When we did the epithelium chapter, we talked about the fact that the skin is full of keratin. It gives it that waterproofing layer, very tough, very dry. We also know that it has an acidity to it because of the lactic acid mantle that we secrete every time we sweat. We know that we have lots of goblet cells and pseudostratified epithelium that surround all our orifices. So we have lots and lots of mucous membranes that can basically immobilize a pathogen. And oftentimes it'll use a generic enzyme like a lysozyme that can destroy bacteria cell walls. Things like tears, urine, saliva, these are all kind of like washing or rinsing actions to get rid of any type of pathogen. So these are once again all examples of a non-specific response. You also can go ahead and take a look at your previous notes when we talked about just our general white blood cells. And for instance, we discussed the fact that if you look at a neutrophil, that one is specific for phagocytosing bacteria. It has an antibacterial quality. All of our neutrophils will react in this way. All of our neutrophils are specific against bacteria. This makes it a non-specific defense. So here on your PowerPoint, it says that your neutrophils will phagocytose bacteria, and they'll do that by releasing hydrogen peroxide and other toxic chemicals, which in that sense will go ahead and destroy the bacteria. Your eosinophils, you might recall, those are the white blood cells that are going to be specific for any type of antiparasitic infection. So for instance, if you have like a tapeworm infection, your eosinophil count will be higher to indicate that your body is actively fighting off that parasite. All of us will have eosinophils, and all of our eosinophils will be specific for antiparasitic actions. Once again, this is an example of a non-specific defense mechanism. How about our basophils? You might remember our basophils. Those were going to come into play, and they're going to release things like histamine. Histamine is a vasodilator. It's going to increase the lumen of our blood vessels so that we can increase our blood flow. This will be fantastic for allowing the white blood cells to be able to mobilize faster to the site of injury. Your monocytes are going to become macrophages. Macrophages have that phagocytotic quality where they can gulp, eat any type of foreign antigen. All of our macrophages work the same. They don't have to be specifically exposed. They will always phagocytose. And even if we look at our lymphocytes, yes, within the lymphocytes, you have your T cells and your B cells. And yes, those are the ones that are specific. So you're correct, but remember that your lymphocytes also generate natural killer cells. And natural killer cells are part of our non-specific defense because they will react the same in every single person. They will be able to come across and identify a foreign cell, and they're able to utilize perforin proteins to destroy. So within your lymphocytes, within those white blood cells, please be very careful when you do your homework assignment or you come across an exam question, because your lymphocytes will either give you natural killer cells, T cells, and B cells. And your natural killer cells will be part of your non-specific defense, or what we like to call our innate defense. We're all born with it. It all reacts the same. Whereas your T cells and your B cells will be part of your specific defense, or what some people like to call your adaptive defense. They will only be generated, T cells and B cells, when you become exposed to a specific pathogen. All right, so let's take a look at our natural killer cells a little bit more. And the reason we want to talk about them with more detail is because they play a huge role in immune surveillance. And immune surveillance is basically the concept that we're born with the ability of certain cells, like our natural killer cells, to patrol the body through the tissues to go ahead and see if there's any type of foreign antigens or pathogens that might be present. And when the natural killer cells is out on immune surveillance and it comes across a foreign entity, what we're going to see happening is that it's going to be able to not only recognize that enemy cell, it's also going to be able to interact with it. And the way it's going to interact is through the use of perforins and granzymes. Perforins are going to be a protein that the natural killer cell releases, and the perforin is going to make holes, kind of like perforations, like a hole punch. It's going to go ahead and make holes within the plasma membrane of the foreign cells. Once it has openings in the plasma membrane, then the natural killer cells is going to release granzymes, which are a specific group of enzymes that will go ahead and enter into the pathogen cell, and it will cause the cell to die from the inside out. It will induce cell suicide or apoptosis. Here, take a look at this illustration. So here we have an enemy cell, clearly labeled on the left-hand side, and we have our natural killer cell that's roaming around doing its immunosurveillance, and when the natural killer cell comes across the enemy cell, it's going to interact with it. And as you can see, the first thing it's going to do is it's going to release perforins, and the perforins will polymerize or make holes or openings within the plasma membrane of the enemy cell. Once it has the opening, the perforin, it will go ahead and release granzymes, and the granzymes are going to be the enzymes that are going to induce apoptosis. So before you know it, the enemy cell is going to start blabbing, which basically means it's going to start shutting down into smaller segments, and that is going to be a sign of apoptosis or internal cell death. And as the enemy cell dies off, we see that oftentimes you'll have another cell, like maybe a macrophage, that will come and phagocytose or bulk eat whatever left over of the enemy cell. So there's a lot of things going on in the slide, and one of the things is obviously the mechanism of action for your natural killer cell, the fact that it uses perforins and the fact that it uses granzymes. But the other thing that this slide is trying to highlight is that your natural killer cells do not phagocytose. They do not bulk eat. Phagocytosis is going to be left over to things like your macrophages. Your natural killer cells are going to kill directly through perforin and granzymes. And remember, each of us, for our natural killer cells, they will have the same exact 4 steps, and that's because natural killer cells are part of your non-specific immune system, your innate immune system. It doesn't have to be specifically trained to do so. It will always react the same way when it comes across a foreign cell. Now, to help along our white blood cells, because we do have a very large body that has to be patrolled, there are different types of proteins that can be utilized to kind of amplify the signal. One of those proteins are called interferons. Interferons are proteins that are released by cells that have become invaded by viruses. And these cells will go ahead and release the interferons as a warning calls to their surrounding neighboring cells to go ahead and start protecting them from the potential of becoming infected by the virus. So it has an antiviral effect. It also has an anti-cancer effect, but for purposes for our lecture, the antiviral effect is where we really are going to take a look at it more. So let's go ahead and let's look at an illustration of exactly how these interferons will work. Alrighty, so this is an illustration that I actually stole from a Pearson book. So it's not in your McGraw-Hill book, but it really does show you how one cell can communicate and kind of warn the second cell that a virus is on the outbreak. So go ahead and take a look at the left-hand side, all the way at the bottom. It's going to say host cell number 1, and it's going to tell you that the virus has infected it. And in fact, if you look up, you're going to see the virus in step number 1 has entered into the cell. And when the virus does so, the first thing it's going to do is it's going to go after its genome material of the host cell so it can start amplifying, start replicating its viral components. And part of what we see happening is when the host cell notices that it's been infected, it will go ahead and start secreting interferons. And notice how in step 2, it says the interferon genes are switched on. And then if you look right below it, it says number 3, the cell will produce interferon molecules. And these interferon molecules, indicated by the little red triangles, will travel over to the cells that are nearby. In our case, it's labeled as host cell number 2. And the interferons will be able to warn the neighboring cells so that the neighboring cells can start producing some of their antiviral qualities, thereby blocking or making it harder for the virus to infect them as well. So interferons are proteins that are being secreted whenever a cell is invaded by a virus in an effort to warn its neighboring cells. Another assistant, quote unquote, to our immune system is going to be complement system. A complement system, it's a little bit difficult to describe what a complement system does because it has so many different purposes. But to kind of keep us on track, I want you to think of your complement system as a group of proteins that you find within your bloodstream. And these proteins are going to be specifically activated when they see the presence of certain pathogen. And when they become activated, they're basically going to work together with your other white blood cells and your immune cells to enhance the reaction. And as you're enhancing the reaction, it makes it easier for you to notice the foreign pathogen and decide on what course of mechanism needs to be done. So it's going to help you go ahead and with pathogen destruction, and what your complement system does is it tends to amplify your inflammation signal, your immune clearance, meaning how fast are you able to clear the pathogen out of the system. It could go ahead and enhance your phagocytosis ability of your white blood cells, and it can also enhance your cytolysis, which is the actual lysis or pulling apart of your pathogen cell. So I know that was a little bit of a long-winded explanation of the complement system. So for our exam purposes, when you see complement system, I want you to think a group of proteins in my blood that will basically amplify my innate reaction. And when they, I'm sorry, not innate reaction, my immune reaction. And when they amplify your immune reaction, they tend to aim for the 4 things that are highlighted at the bottom. So inflammation, immune clearance, phagocytosis, and cytolysis. Now, another way that your body can use a non-specific format of our immune system is going to be through the use of inflammation. Inflammation is a fantastic defensive response. It's usually right off one of the first responses to tissue injury. We usually indicate inflammation by terming it itis. So things like arthritis will come into play. When you have inflammation, you usually have 4 symptoms that always show up. These are the cardinal signs, and they are going to be redness, swelling, heat, and pain. Now, you're going to see these 4 signs because of the events that occur during inflammation. And that's the fact that whenever there is tissue injury, the first thing that's going to happen is your immune system is going to detect it, and it's going to go ahead and recruit additional white blood cells and body defenses over to the area of injury. It's going to start contain and destroy those pathogens. And then obviously we also have to clean up the tissue, and we have to start initializing the repair of any damage to like our epithelium or connective tissue. And as it's doing these 3 main processes, we're going to see that it's going to go ahead and have a high amount of red blood cells in that particular area. That's going to cause the redness to appear. That's your erythema, high levels of red blood cells. We see that with more cells, you tend to have an accumulation of fluid, which is going to be your swelling or your edema. We also know that more cells will mean more metabolic actions, which means that they generate more heat. And last but not least, we're also going to stimulate pain, because pain is going to allow us to immobilize that area of injury, making it easier for our immune system to repair and clear out the pathogen. Let's take a look at this from an illustrative aspect. Okay, so my apologies, the picture is coming up. But before we do that, on this slide, it basically says that if you have any type of damaged tissue, you will release different types of messengers, such as bradykins, histamine, and leukotrienes. And these protein messengers are basically going to cause vasodilation, meaning you increase the lumen of your blood vessel so that you can go ahead and have blood flow faster. And that, of course, is going to lead to more red blood cells or hyperemia, which is obviously the redness and the heat. And also, it's going to make it easier for your white blood cells to go ahead and arrive at the site of injury. And when the white blood cells get there, we usually see that it's easy for them to hop from the blood vessel into the tissue, because the capillaries will often have a higher permeability in an injury site, making it easier for them to kind of move from one section to the next. Okay, here's my illustration that I was talking about. Okay, so go ahead and take a look at the left-hand side, and we see that a splinter has entered into, let's say that's a finger. So the splinter has entered into the finger, it has gone through the epithelium cells, and it's in the connective tissue, and the splinter brought along some bacteria, indicated by the green little rods. So the first thing that's going to happen is, remember, this is going to be an innate defense, so a non-specific defense. All of our bodies will have the same initiation. When this happens, is that it's going to release inflammatory chemicals. And these inflammatory chemicals, so think about like your histamine, are going to basically recruit over the white blood cells over to the site of injury. So they're sending over a SOS signal. We have injury, bring it over. And when it's releasing the inflammatory chemicals, it's increasing the amount of red blood cells, it's increasing the blood flow, and it's also increasing the white blood cells that are coming over. It's increasing or stimulating what we call margination. Margination means that as the white blood cells get closer to the site of injury, they're going to start adhering to the sides of the blood vessels. And as they're adhering to the vessel walls, they're basically looking for small openings that they can go ahead and squeeze out of the blood vessels into the actual tissue. When they squeeze through the blood vessel, and they can do that because you have increased permeability at the site of injury, the movement of them going from the blood vessel into the tissue, that is called diaphysis or immigration. So that's when they move out of the blood vessel and into the actual tissue space. And as you can see, for step number 4 and 5, you're going to see chemotaxis, which means the white blood cells are responding to the chemicals, and they're responding. They're going to start initializing phagocytosis, which is the bulk eating of the bacteria. And once again, this is all an example of an innate reaction, so a non-specific defense form. We also know that once inflammation has occurred, we do have to start cleaning up the tissue. So usually we see that after about 8 to 12 hours, the monocytes will have plenty of time to become macrophages and start phagocytosing the foreign entities. We're also going to notice things like edema, so swelling in the injury site. And the reason for that is because we're going to lower our venous flow, but we're going to increase our lymphatic flow. We want more of the fluid to go into our lymphatic system so that we can properly filter out the bacteria and any type of debris or foreign entity. A lot of times you'll also see the formation of pus. Pus is basically a mixture of your tissue fluid, whatever debris the cells have left behind, whatever type of pathogen is dying off, and also whatever type of white blood cells were sacrificed during the process of restoring or cleaning out the site of injury. You're also going to have some fibroblasts. These cells, remember, blast is for building. They're going to help you repair your connective tissue. You'll have hyperemia because you've increased your red blood flow over there, which means it makes it easier for you to get stuff like oxygen and nutrients. And as more and more cells accumulate, it will generate a higher level of metabolism, responding to the heat that you'll tend to feel in the site of inflammation. And lastly, at the bottom, it says that you will have pain because it will tend to limit the movement of the body part, making it easier for repair to occur. And our last thing I want to discuss in part 1 of chapter 21 is a good old-fashioned fever. A fever is another example of a non-specific defense. It is an innate response to a foreign pathogen. And when you have a fever, that basically means that you have spiked your internal body temperature. So we've moved away from the 37 degrees Celsius or 98.6 degrees Fahrenheit. And what we see happening with fevers is that it usually means that your hypothalamus has been alerted that there are pyrogenes being released. Pyrogenes are chemicals released by macrophages. These pyrogenes have the ability to tell the hypothalamus to increase the body temperature, aka producing the fever. And what the fever will do is it's going to do different things. First off, it will promote interferons. That's one thing. But more importantly, it's actually going to go ahead and increase your metabolic rate, and it's going to increase the sensitivity of your immune system. So it makes it easier for white blood cells to go over to the site of injury. The other thing that it will do is because you increase your body temperature, it will actually inhibit pathogen reproduction because the increase in temperature will make it too hot for the enzymes for the bacteria or the different pathogens to actually assist in DNA replication. So a controlled fever is a very good thing because it kind of helps you increase the sensitivity of your immune system, and it makes it harder for the pathogen to increase its load. Now, a lot of us, when we have a fever, we'll go ahead and we'll get things like ibuprofen or Advil. And what those medications do is they basically stop the communication between the pyrogen and the hypothalamus, and the hypothalamus will go ahead and restore itself back to its 37 degrees Celsius. AKA your normal body temperature. This then often means that you'll feel more comfortable because you don't have a fever, but oftentimes it will take your immune system a little bit longer to fight off the pathogen because it doesn't have that added benefit of accelerating your metabolic rate and increasing your sensitivity, all while making it too hot for the pathogen to kind of replicate. So that is then where that saying comes in that you should sweat out a fever, because a controlled fever is a very good thing. Now, I keep saying controlled fever because if it does get too warm, and we're usually looking at a number that's above 105 degrees Fahrenheit, then you really do want to go and seek medical assistance, because at that high temperature you can have protein denaturing, meaning that your enzymes start to unfold and they stop functioning. And as the proteins unfold, we literally start seeing that the organs will start shutting down, and it could be detrimental to the system because you're basically overheating from the inside out. Alrighty, I did not realize that this lecture was going to be so long. If so, I would have divided it into 2 parts. So I really appreciate you hanging out with me and listening to all 1 hour and 3 minutes of me talking. That was a lot of talking. Alright, so as usual, take your time, go through the audio, make your notations, and hopefully we can chit-chat in the discussion session, and we'll meet up soon, and we'll take a look at part 2 of chapter 21 on the lymphatic system and the immune system.